Ovarian Cancer Awareness Month, and it's important to know the symptoms because ovarian cancer is the 5th leading cause of cancer deaths in women. Joining us live now over Zoom, we have Tonya Gandy-Hamilton. She's with the Alabama Department of Public Health. Tonya, thanks so much for joining us this morning.
Thank you.
Talk about ovarian cancer and who is really at risk for this.
So ovarian cancer starts in the ovaries, of course, which are on each side of the uterus. It is one of the common gynecological cancers besides cervical, uterine, vaginal, and vulvar cancers. It is the second most common gynecological cancer and also the worst. If you still have your ovaries, you are at risk, and the risk increases with age.
What are some of the signs and symptoms, especially as we age, that we need to look out for?
So the symptoms you want to look out for are abnormal vaginal bleeding or discharge, feeling full too quickly, or having difficulty eating, bloating, abdominal or back pain, and pain or pressure in your pelvic area.
If someone feels like they're having some unusual symptoms, who do they need to talk to? Who should they make an appointment with?
So talk to your doctor immediately and tell them about your symptoms, especially if the symptoms has lasted for 2 weeks or longer. The reason why this cancer is hard to find is because of how common the symptoms are and because they can be linked to several other illnesses. But we tell women to make sure they know the symptoms, pay attention to your body, and when you notice anything unusual that lasts 2 weeks or longer, tell your doctor. Currently, there are no set guidelines or screening tests for ovarian cancer. It's not like the other cancers with screening tests like getting PAPs for cervical cancer or mammograms for breast cancer or the colonoscopy for colon cancer. So the best thing for any woman to do is know your body. Try and prevent this cancer as well as any other cancers by living a healthy lifestyle, which we know is eating healthy, exercising, and no tobacco use or alcohol use.
Do you think,
Please remember to get with your doctor if you are experiencing any of those symptoms.
You said there's no screening right now for ovarian cancer. Do you think that'll change though in the future?
Well, researchers are actually working on that, so we're really hoping that it will change in the future.
What are some of the treatment options for those who are diagnosed, especially early on?
Treatment option depends on the type and stage of the cancer and might include more than one type of treatment, which may include surgery, chemotherapy, radiation therapy, hormone therapy, targeted drug therapy, and immunotherapy.
You said to look out for the symptoms. Talk about, though, how important it is for not just women, but all people to get those regular checkups and have a doctor that you see annually.
It is very important that you get your regular checkups. Like breast cancer is annually, making sure it's just important to talk with your doctor. There should be no excuse, and just make sure you keep your doctor involved with your body and know your body. And when anything is out of order or feels weird or unusual, just make sure you talk to your doctor.
Again, this month is National Ovarian Cancer Awareness Month. Anything else you want people to know about this type of cancer?
Just to know more, just talk with your doctor, your primary care provider, or your gynecologist when it comes to those like ovarian cancer or cervical cancer. American Cancer Society is also a good source, and we have this information I provided you today in the Alabama Cancer Plan, which is located on the Department of Public Health's website at www.alabamapublichealth.gov.
Tonya, thanks so much for all of that information, and thank you for joining us here on Alabama Live. We truly appreciate it.
Thank you for having me.